This is Bobby again from Central Oahu Physical Therapy Specialist. Today what I'm going to talk about is range of motion in your shoulder. The most common direction that people have challenges with relative to flexibility in their shoulder is the ability to reach up and behind their back. That's a combined movement of which we call internal rotation, extension, and adduction. Now, there's multiple reasons that could be leading to this or problem sets, but the most common being is having an inflexible posterior capsule. And what that means is you have inflexibility or tightness in this ligament in your shoulder joint, specifically this ball and socket. Okay, so what we're going to do is we're going to go over 2 effective stretches that can help to improve this flexibility. Okay, so the first one is you can lay on your side or you can stand by a wall. Okay, so if we're doing our right shoulder, you stand with your right side of your body perpendicular to the wall. You lift up your right arm and keep your elbow at 90 degrees. We want our elbow at shoulder level. Now, as we lift up our right arm, our tendency is to let that shoulder go forward. Make sure your shoulder stays back in that socket, okay? What we're going to do is keep our wrist straight. You're not pushing at your hand. You're pushing at your forearm, okay? And you're going to push your forearm down. And as you push down, if you're inflexible or tight, your shoulder's going to want to pop up. Make sure that shoulder stays down and back. Once you feel that resistance, just hold it for 15 to 30 seconds, okay? That's number 1. The next exercise is basically taking yourself into that same direction that you have challenges with, which reaching up and back, but using an assisted device. So we like to use a belt. Some people use a towel. Sometimes the texture of a towel can be hard to pull. A belt is smoother. So if I was facing my back towards you, you bring your left arm behind, right hand grabs the towel or belt, shoulders are back. I'm pulling the left arm down as far as possible so that my hand goes up as high as it can on that right side. Now, as you pull up even further, the tendency and the most erroneous behavior is, again, we're going to start to bend forward, going into this flex position. Make sure your shoulder stays back. Keep it pinned back. Elbows back too. Hold it for 15 to 30 seconds, okay? We're not pushing into agony. You will get some degree of discomfort. Stop at that first level of discomfort, okay? So those are the 2 stretches. Now, if your range of motion, in the ideal world, your theoretically normative range of motion is the ability to reach up at least to the lower part of their shoulder blades. Okay, now if you're halfway there, your range of motion is maybe 50%. So halfway between your tailbone and that shoulder blade, your range of motion is 50%. So you could potentially get away with doing this exercise 3 to 4 times a day. Now, if you can barely get your hand to the mid crease of your butt or your tailbone, your range of motion is more like 80-90% loss. So we would recommend doing this exercise at least every 2 hours a day. Now keep in mind that if you have limited flexibility in reaching up and back to your shoulder blade area, it's more than likely associated with some degree of pain. So performing these flexibility exercises not only help to improve your flexibility, but help to reduce your pain. And it can also help to reduce other compounding injuries associated with your shoulder. It's not normal to be able to reach midway up or even close to your butt. You should be able to go all the way up to your shoulder blade. Now just keep in mind, if you're having persistent pain in your shoulder, these exercises aren't meant for everybody, and it's best that we always recommend that you get evaluated by a medical professional, albeit your physician or a physical therapist. Thank you very much. That's the tip of the day.